Thank Dr. Julio Montana to organize a very important meeting. I'm going to share with you how China takes actions towards 390s. In order to move to 390s, we need commitment. The most important is a policy commitment. China committed. In the 1910, that time we do not call 390s. We have new policy called 3 expansion plus 6 strengthening among 5 expansions. The first one is expanding HIV testing to encourage people to test as many as possible, to identify people infected as many as possible. The second expansion to provide treatment to people infected as many as possible. You have policy in places. You do need money to provide testing and treatment. Chinese government committed to scale up, provide funding for HIV/AIDS program. Now the government funding accounted for over 99% of total funding in the country. Previously, international support was the major funding support for China National Program. Started this year, Chinese government set up special funding for NGO and CBOs. That is about 50 million Chinese yuan. And also we have commitment for implementation. We're scaling up all effective program. Also, we monitor implementation. We create very nice digital program to monitor progress we made. That including testing, treatment, and intervention. Regarding testing, last year, we encouraged 127 million people being tested. We newly identified 103,500 cases. This year, we further expanded testing. Just for first 6 months, we have already reported over 60,000 new cases. In order to provide treatment for people as many as possible, last year we changed our criteria for initiation of treatment to CD4 less than 500. And each year the number of newly enrolled to ART continue to increase. This is not cumulative. Each bar represented the number of newly enrolled to ART. I was convinced by Professor Julio Montana in the 2010 treatment as a prevention. Then when I come back to China, we take action. We take one of a specific group, discordant couple, to implement treatment as prevention. You can see in this marked as yellow background, the ART treatment among discordant couple, the coverage continued to increase from less than 50 in the 2010 to last year, the coverage 74%. The condom use remained similar. Just because of ART coverage increase, the incidence among newly identified discordant couple continue to decline. China move fast. Usually when we have policy, first you have scientific research finished. Then you get the result published in the scientific journal. Then you set up a policy. Then you implement. Now we try to move quickly Once you have scientific study finished, we do not wait. You have paper published. Then we immediately set up policy and implementation. Because when you have scientific research finished that biologically makes sense and significantly in the public health, we do not need time for tiny accuracy to get that published. Once you get paper published, review process takes 6 months, 1 year, even more than 1 year. In the past 10 years, the diagnosis rate increased from about 20% in 2005 to last year 61%. And ART coverage less than 10% in 2005, last year 60%. The viral suppression about 86%. We made good progress. We have no room for complacency. There is Chinese proverb. It is still halfway, even though one has made 90 miles out of 100 miles journey. We have no room for complacency. We still face challenge. Epidemic continuing to spread among certain groups, particularly among men who have sex with a man. The prevalence continue to increase, particularly in the young generation, including college students. In order to meet challenge, we need to understand human being is not just biological issues, it's combination of biological, social issues. We need to understand what's a true epidemic. We need to use the precision epidemiology to guide us to response to epidemic, to help us move towards 390s. Thank you for your attention.